Sawasdee krap and good afternoon. Today is Wednesday, the 13th of January, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So I'll start off first with the general situation and the number of cases as reported to you by Dr. Thuisin, the spokesperson who has now returned from the inspection site visit in the various provinces. So the new confirmed case, we'll have a slide coming up to you soon. I'd like to start off with the key word, the key number. So if someone asks you how many people in Thailand are currently having active cases of COVID, or simply how many people in Thailand have COVID at the moment, the answer is 3,981, so less than 4,000 active cases. So with the new wave that we had met with in December until today, there had been an increase in the number of persons infected, as well as a decrease because of the recoveries. So we have to subtract that number off. But to make things simple, we've put the green box in the slide that you see on screen. That's the keyword. Less than 4,000 people now in Thailand are actively being infected with COVID positive. But of course, we have to do the numbers and tally the numbers from the beginning of last year until this year. And in total, it's been up to 10,991 persons. But in that number, 6,943 have already recovered or been discharged. So doing the math, that's the active case number that we have in the green box on top. Daily numbers, we'll still continue tallying that. We recorded 157 people being infected, new cases today, and the number of those who died or fatalities still remain constant. The number of fatalities recorded for today is 211. So as you can see, daily numbers now are getting stable. It was around in the 200s for the past many days of this week, and now it's 157 recorded for today. But nevertheless, the grand total of those who are still actively under treatment is 3,981, so less than 4,000. So just some observations from the presentation by the spokesperson. If we have a lot of statistics and numbers on hand, and then we display some of them from time to time. The spokesperson showed us some numbers just now that if we look at the whole year, 12 months from January last year until today, for example, January of this year, the number that you see, of course, is around over 10,000 being infected. But if we separate the new wave, particularly only those infected during the new wave since December, it would be around 6,000. So that's the sort of information that we are looking into and analyzing. Right now, we have designated various provinces in the level 1 highly controlled area, as you know. These provinces have more than 50 cases per province. Some of these provinces, most of them are in the central and eastern region. When the spokesperson traveled to Ubon Ratchathani yesterday, provinces in those areas are also designated. And when he traveled from Ubon Ratchathani back to Bangkok through Nonthaburi province, there, of course, was this precaution that he was traveling from a province that had highly controlled, those highly controlled that had high numbers. So the precaution is that if you travel from provinces that are highly controlled or controlled, of course you would have to look at the measures in the destination province as well. So for example, in Nonthaburi, they announced that if you travel from highly controlled areas, you would have to undergo home quarantine, just as an example. So in terms of the provinces, the spokesperson highlighted that as of now, we have now 60 provinces in Thailand affected by COVID, 60 provinces with COVID cases. So therefore, there remains 17 provinces that have not found any COVID case at all. The 60th province, the newest province in that number is Pisanulog province. That's the newest province that found COVID infection. And there was only one case there, but of course, with one case, we still put them in that list of provinces affected. There are, of course, in the highly controlled provinces, a number of provinces which the spokesperson highlighted, around 10 provinces that include provinces like Bangkok, Rayong, Chonburi, and the like. These provinces are very crucial for us to stop the high numbers, to decrease the numbers, to stop the curve from heightening. And if, of course, the efforts are consolidated in these provinces, the energy is put together, is synergized in these provinces, that will make a difference actually for the whole country. So these provinces, the residents and the authorities in these provinces are very crucial. It's very important to put their efforts together to stop the curve from increasing in the whole country. That would affect the whole country. The spokesperson, aside from visiting Ubon Ratchathani, he also went to Amnat Jalon province, and he also inspected some bus and vans, public vans, the transportation lines, routes there. There were some images shown there. And all in all, it was satisfactory. The people in those provinces, in that region, they cooperated very well in terms of the health precautions, wearing masks and everything, and the use of the public transportation system is satisfactory in terms of the health measures. The province of Amnat Jalon is also preparing for a field hospital. The spokesperson and the team of the Inspector General of Region 10, the Public Health Region 10, visited Mahidol University at Amnat Jalon campus, that university's campus in Amnat Jalon, to inspect the building and the areas that might possibly be used as or constructed to become a field hospital. Yes, so Mahidol University in Amnat Jalon campus is prepared for that, and then we will, of course, be doing this in many provinces, and many members of the private sector or universities are offering the government, the CCSA, and you see an image there on screen, with ample space to put beds for patients for this upcoming field hospital that are distant from each other, 2 meters distant from each other. So that is some good news in preparation to be able to address any possible new surge or new spike in the numbers in those areas, in that region. That's the Isan region and southern Isan region in the northeastern part of Thailand. So that will continue, and you have very good images there. Yes, just some pieces of information that is maybe useful to the English language community and the foreign media as well that are viewing this in Thailand, as well as from social media in any corner of the globe, for those who are interested in Thailand or have friends and relatives in Thailand. The Prime Minister yesterday briefed on the situation after the cabinet meeting yesterday, and mentioned that even though this outbreak has caused a rather high number of confirmed cases in the outset, around 500 new cases per day during the past weeks, and they became 200, higher 200s and then lower 200s, and now it's 157 today actually. So hoping this number will be remained. So he mentioned that although there was a high number of 2 to 3 up to 500 per day, but the tendency now is getting stable. On the other hand, at this moment, we have experience and measures to control the spread and give and provide improved treatment to the patients. In the past 4 days, I've reported to you new recoveries, recoveries, around 100 or 200 persons per day recovering or being discharged. In the past 4 or 5 days, we have around 1,500 recoveries already, only in the past 4 to 5 days. So this has shown that we have better preparation this time, actually. The Prime Minister also warned that as long as we still have hundreds of cases per day, the cooperation from the public and all sectors of society to curb the spread is still necessary. On vaccine policy, the Prime Minister mentioned that the government is now accelerating the procedure for the vaccine registration in order to expedite the distribution once we get the vaccines, especially from AstraZeneca, which Thailand was granted rights to produce the vaccine in Southeast Asia. The Ministry of Public Health also prepared the distribution plan and announced the distribution plan in accordance with the international standards by prioritizing high-risk groups as the initial batch for receiving the vaccine, medical personnel and high-risk groups. Lastly, the Prime Minister reaffirmed the government's preventive measures. The measures have not included the closing down of public places and travel restrictions in a larger area. Many parts of economic activity around the country can still normally continue, and expenditures from the government in boosting the economy in these various projects like the half-half co-payment scheme, it has been continuing and ever since the new wave began. So just a little bit on that, on some government relief measures, just in passing, because yesterday the Cabinet approved new relief measures to ease the people's economic burden by reducing the cost of living expenses and monetary aid for most affected people. For example, cash handouts in 2 monthly payments to nationals who are informal workers in the informal economy, freelancers, farmers, and those not covered by Social Security system, for example. Around 30 million will be expected to be eligible. Second, as mentioned, the half-half co-payment scheme in restaurants and business establishments in the country. That has been ongoing, phase 2 already. Third, also reduction of electricity and water bills for the months of February and March. Each household will, with electricity consumption up to 150 units a month, will get the first 90 units for free. And more details, of course, you can find that. It will, of course, be in the mainstream media. The government will also provide soft loans through the government savings bank to those eligible. And in terms of the big budget, with sufficient budget to cope with COVID, about 470 billion baht is still remaining from the 1 trillion baht budget of the Ministry of Finance and the contingency fund, of course. So all of these are being prepared and worked out to ease the hardships faced. So just some clarifications on the level of the symptoms of some of the people who are affected. Firstly, as I mentioned in the beginning part of this briefing, that there are less than 4,000 active cases of COVID in Thailand, 3,981 to be exact, as you can see on screen. Now, out of this number, 3,981, there are around 2,588 out of that number who are currently receiving treatment in hospitals. Now, the remainder of this number, so 3,981 minus 2,588, the remainder are not in hospitals, meaning that they are either in quarantine or in hospitals and things like that, or field hospitals, right? So this number in particular are those in actual hospitals, 2,588. Now I bring this out, 2,588, because we have the information on the level of symptoms, as you can see on screen. Just from this particular group in actual hospitals, only a small number are in severe cases. Around 202 are in the moderate symptoms. Around 800 plus have mild symptoms. And the majority, 1,502, are actually asymptomatic. So this actually gives you a picture of the level or the degree of the symptoms of the patients who are positive of COVID and hospitalized. So this is information from the Ministry of Public Health, courtesy of the Ministry of Public Health, is extracted. It's a number which is extracted to show you the actual level of the severity of each case. So you can see that severe cases is not that high, around 20 that number. Thus, a reflection of the treatment and the care that the attention that we give to those who are COVID positive in our health care and medical system. So it indicates also that the trend that the majority of patients have mild symptoms or are asymptomatic, which actually causes a little bit of concern still actually, because if a lot of people are asymptomatic, then we really have to be careful. And since people are asymptomatic, one way to help track that, of course, is หมอชนะ application. If you remember yesterday, I showed the screen of my phone. If I've met someone who has very low risk, that'll be fine. But the next day, if he or she is found to be sick with COVID, the day he or she met me, he or she might have been asymptomatic, so he might not have warned me on หมอชนะ application. But the next day or week, if he or she is symptomatic, it becomes red, in the red level, then I will be warned, I will be alerted on the หมอชนะ application. So that's very important because most of the people in Thailand who are COVID positive have been found to be positive are actually asymptomatic, as you can see in the statistics and numbers that I showed to you just now. On the other hand, it could also cause difficulty in terms of diagnosis and prevention in the public, which should lead to some risks and high-risk group of people. That's about being asymptomatic. So we suggest that everyone strictly adhere to the preventive measures and the health guidance and หมอชนะ application, as we have reminded you time and time again. So just in closing, we see a number of confirmed cases, the number of confirmed cases today to be less than 200 already. While we can remain hopeful that the situation is getting a little bit stable, it's important that we continue to be vigilant and cautious. Therefore, the public and the business owners and sectors are encouraged to continue to follow the recommendations and guidelines and advise your employees and your workers to do the same to reduce the risk and prevent COVID. We'd like to present from time to time to you some tips which are helpful for the food and beverage business owners in the country. For example, recommended that shops and restaurants should keep each customer at least 1 meter apart in the queue, and provide them with alcohol gel, and the service area should be well ventilated and clean at every hour. I'm sure that's something that restaurants often do already. There are people cleaning and signing in, they're cleaning in the restrooms and everything, and in the dining areas every hour. All staff required to wear face masks. Owners should ensure that all customers check in and check out the applications, the ไทยชนะ application. That one is for entry into establishments, and of course in themselves with their cell phones having a หมอชนะ application as well. So we will be coming back to you again tomorrow. I believe the spokesperson, who is also the Inspector General at the Public Health Ministry, will still be having some other provincial trips this or next week. But in any case, we will continue to provide you with the information here in English and also on the social media platforms and online as well. So please continue to follow all of these important information for all our own safety and the safety of the ones we love. So thank you for your attention today, and I'll see you again tomorrow. Thank you. สวัสดีครับ